What up? And my man, Dr. Anuj Shah, pulling up.
Dr. Shah, come on down.
Hey, hi, my name is Dr. Anuj Shah. I happen to be a cardiologist, an entrepreneur, and have my company called Apex Heart and Vascular, where we provide care for people with failing hearts, great hearts, from sickness to wellness all the way. I'm also very interested in role of fitness, tracking devices, artificial intelligence. In short summary, I'm in the business of healing hearts.
I love that.
Love that, dude.
We got to start off over here. I mean, we can't leave a guy who's in the business and healing hearts, you know? So now, Dr. Shah, we were familiarized with each other through my understanding of what you're doing on the AI side in that AFib research, right? But I recently saw what you did in Medium kind of ties a lot more into what the conversation is over here. First of all, I was telling my friend Troy over here, hey, I don't know who your primary care physician is, but you need to get rid of him right now.
Yeah, absolutely.
Because Dr. Shah is the person that you need to be talking to. And, you know, I forwarded that email along, and, you know, I pick up so much of your language. I'm a fan of it instantaneously, especially how you have this holistic approach to everything that you're doing. And that's kind of going to be a reoccurring theme that we're going to see inside here as we go through. Troy, you want to kick off asking Doc a couple questions before we jump in?
Yeah, someone who works in medicine, what are some of the ways that technology made you an understanding of wellness more complete, so to speak?
Yeah, so I think wellness is the new buzzword, right? I mean, traditional medical training has been all about sickness and taking care of folks and patients who are sick and focusing on that. But that's truly, if you look at overall population, that's tip of the iceberg. I mean, there is a whole submerged population, I want to say like 90% of the people who are on the spectrum more towards the wellness side. But that's only physical wellness. I think we know wellness has so many more components. And some of the components within wellness, spiritual wellness, social wellness, emotional wellness, those things actually are very connected to physical wellness. So I think paying more attention to wellness means we gotta pay attention to spirituality, paying attention to people's emotional health and their overall mental health, you know, and making sure that we are taking care of folks as a whole and not just focusing on their, oh, somebody has high blood pressure and high cholesterol and diabetes, but why so? You know, that why so is the reason. Oftentimes, people know they gotta do the right things. They know they gotta exercise, they know they have to have the right diet, they know smoking is bad for them, but why are they still not doing it if everyone knows that? Because most people don't know how to form a habit. Mm-hmm. So habit formation is a key. Mm-hmm. And at the end of the day, it's truly mind over body. If you train and coach your mind, you can actually direct and dictate your body in terms of what needs to be done. So I really think of body as this gentle elephant that is very difficult to move. But mind is the person that goes on top of that elephant and slowly stirs the elephant. So if we know as a mind, you know, in other words, neocortex versus limbic system, I can go in more detail. One is the emotional mastery, one is physical mastery. You can get and gain physical mastery of any skill, any task, any habit, as long as you have emotional mastery over it. If you know how to stir this gentle giant, this giant elephant, it works. It works slowly, but then you can build habits, you can change lives, and you can truly keep gaining momentum on the spectrum of wellness.
I love that. And let's stay.
I love it.
See?
I think, you know, and I resonate with it. I think most people feel like their growth happens when you're most vulnerable. I mean, as a scientist, I would vouch for it because science now supports this. Obviously, we sort of know this, but when people are at their emotional worst, when they have gone through a major pain, major trauma, for lack of better words, heartbreak, and we see that, scientifically we see that. When somebody has a heart attack, you know, they actually end up doing a lot better because they need to hit that catastrophic moment, and then that changes the way they react to it. So vulnerability opens this tiny window where amazing opportunities can come and arise. So I think being vulnerable, being hit by a very low point in life could actually truly be uplifting and creating this window. So yeah, it was great what you said.